Thank you for having me. It's a great pleasure to meet audience in Paris. I'm Karen Chen, assistant professor of urban planning and environmental health from University of Washington. Today, the talk will cover a case from Denmark about how density, Professor Angel already talked a lot about density, and I'm very glad you have foregrounds what I'm going to say. But the case will be focusing on how density mean for mental health. To begin with, I would just start with a simple statistic. By 2050, we know there will be an additional 2.2 billion of people live in cities. And to accommodate such high population growth, can you imagine how much land are we taking every single day to construct new buildings? It is 20,000 American football field every single day. And how these cities are built will have significant implication for the environment. Okay, let me see if we can move to the next slide. Okay. For energy consumption, we can see on this figure, there are different kinds of cities around the world. And there's a big contrast between European cities and North American cities. Where you can see European cities has much slightly higher density, but much lower transportation-related energy consumption. And this makes sense for me when I was living in Denmark, every day, walking, biking to grocery so easy. But now in Seattle, without a car, it's impossible to reach a grocery from where I live. So definitely how land use are planned and the density have significant impact on greenhouse gas emission. How cities are built also have impact on biodiversity. This study shows us that in New York City, when the density of built area is higher, the genetic biodiversity is lower. This means that if we think about cities as also an urban ecosystem, how cities are built also have influences on different kind of species and how the biodiversity are. Well, it also have an implication on human well-being. If we think about thermal environment, and I really like this study because it provides three different scenarios like we talked about before. We can kind of infill city, we can grow up, we can expand outward. And each of them, for example, the most severe urban heat island effect that was stimulated in Berlin would be the case that have replacing green space into buildings in the central infill case. So it is not surprising to us that how cities are built and urban density have implications for cardiovascular disease, respiratory disease. It is not so intuitive for mental health, although it is a very common human experiences. We know one in three people in any stage of our life will be affected by any kind of mental disorder. But at the same time, we also know that, We also know that depressive disorder is 39% more prevalent in urban area than rural area. So there have been two very simple theories behind why urban area have higher risk of depression. One is if the city is denser, you'll be riskier because of overcrowding, because we have less green space. While another hypothesis say if we have larger population, you'll be less riskier because of there are opportunities for social interaction. Well, if we put these two hypotheses to be contradictory. But if we put a satellite images or a photo taken from the sky to see how city looks like, the density is not just two-dimension. In this downtown area like this one, it has more high-rise buildings and high density, while this one has similar building density, but it has much lower high-rise buildings. In the third case, if we move further outskirts, it's still residential. It's just like much more green space and trees on the street. So to provide same amount of population growth, we can have two different kind of built environment. One is high density low rise, the other one is low density high rise. And in the past few years, my colleagues and I are working on this simple context, like about whether higher building density and higher building height will have negative impact on mental health. So we simply have these two dimensions, like horizontal dimension and vertical dimensions. This seems to be very simple, but if we translate this into our real landscape, then you can see other kind of neighborhoods that we are familiar with. It's not just the rural area and urban area, there are also other kind of design in different places. So if we're going to answer this question, how does urban form associated with the risk of depression, then we actually need to first know what is the built environment and what's the natural environment, and we need method to measure them because environment are always changing, there are action being taken, so we need quantification that can help us to observe environment across time. So I want to show this method, remote sensing. It gives us satellite images over the past 3 decades that can help us to understand how land cover and the built environment have been changing. In my research, we developed machine learning models. If we think about it in a simple way, it's basically taking images and taking training data that can be any attribute that you are interested in. It can be green space, building height, or building density. And by using different models, we're able to predict urban form over time. This model was developed in Denmark, but we also apply it to other European cities, including Paris, and show decent results. So now, if we have this kind of information, we can link this to population health data to further understand how there's different urban form associated with depression. Right, so I'm going to move to this section. For mental health, for each single individual who born in Denmark after 1955, we follow up their medical records. And for the adults above 25 years old, there were in total 75,000 Danish have been diagnosed with depressive disorder. And at their first episode of depression, we went back 5 years to look at what kind of environment in their neighborhood, which is a 250-meter buffer around their home, what is the urban form type around their homes. And then using statistical methods, we can further validate what kind of urban form are associated with depression risk. So I'm going to show you the result in the next slide. So in our model, our baseline is rural area, low density, low rise. And other 5 types of urban forms at the left-hand side are different building density and different building heights. If what we know was true, that urban area in general always have higher risk than rural area, then all the dots should be at the right-hand side because the baseline at the 1 is the comparison with rural area. Which was true for some cases, like this one, medium density, low rise have the highest risk among all kind of urban form. While there were also exceptions. For example, low density high rise have lower risk compared to rural area. If we further adjust it for socioeconomic factors, like comparing people of same income level and same education level, we find out actually in the downtown, the high density, high rise area does not significantly different from rural area. So I was very curious about why does that happen, and we tried to map urban form and risk geographically. So this map shows us that for the lowest risk category, low density high rise, it's usually the neighborhood they are in front of large green space, canal, or ocean. While the other category, the medium density low rise that have a higher risk, is the area where we can see the dark line outline at the outskirts, in area mostly single family housing and are more car driven. So I want to come back to the question that we asked in the beginning, like how does urban form correlate with depression? We find out urban area might not just be the culprit, like it might not just a single problem. Actually, in urban area where there are green space, where we can have access to like places people can gather, take a beer and hang out with friends, are area where people are happier. So this figure at the right-hand side shows that in Denmark, the area where population grow the most are also area where vegetation increases the most. So urban, rural, or natural, artificial, like these binary thoughts might not be contradictory. It can coexist if we design them well. Okay. But we also talk a lot, like in a symposium, about affordable housing, like and accessibility to this kind of health-promoting neighborhoods. It is not affordable for everyone, and sometimes when the central area getting upgraded, it also move people out to other places if they cannot afford a housing price rise. But I think like this tool, like using remote sensing and using machine learning to measure the built environment, provide us a kind of method that we can provide evidence about what is matter for local areas, and we can further use them as a tool to convince policymakers. So in the end, I just want to briefly show you a few slides about the potential of using remote sensing for sustainable urban development. We are talking a lot about like urban environment, different metrics, but eventually they are affecting people's behavior and how we are exposed to different environmental characteristics like air pollutant, thermal comfort, and those will affect our public health outcomes. We are living in an era where in the past decade, a lot of satellite data, like I'm using that right now, were not publicly available, but most of data now are available, and they are like observing the world like in both global north and global south. This data today, the one we use for measuring building density and height, were optical data, which is the kind of data when you open your Google map and you can show up the satellite images. That kind of data is called optical data. But there are other kind of sensors and signals which can tell us other information, such as where are higher air pollution, where are higher temperature, and those observations are wall-to-wall, like across space and over time, which can help us to dig into questions like when a policy intervenes, is it validated? Like this kind of question can be further investigated. So I just want to provide 3 key areas that I think is very promising for students and for urban planner to use, because we are in an era where open science is the emerging trend. Like now when we publish a paper, we also need to publish our method and code. So you can, when you download a paper, there's a section called code availability, and you can access to the method and use for yourself. And Google Earth Engine is the second thing in the last 10 years, where these images in the past, like without storage in your computing, on your computers, it's impossible to do large-scale analysis. But this platform nowadays, it can help you to collect data, analyze data in just a few seconds, because the cloud computation is now free. And the third thing is if you want to run machine learning or deep learning models, it can be very time consuming, like running days and days. But with GPU, the supercomputing resource that you can do that, and it is also publicly available resource. So I think that's all for me, and thank you for your attention.